For people living in Scotland's most deprived areas, life expectancy is 13 years less than those living in the least deprived areas. NHS Health Scotland is working to reduce these stark health inequalities and holistically improve public health. Julie MacDonald visited Glasgow to find out more about their local and national work.
For decades, there's been a huge effort to heal Scotland's health divide. Nowhere is the gap more visible than in the powerhouse city of Glasgow. Health inequalities across Scotland are growing, and since the 1970s there's been irrefutable evidence that the problem is getting much, much worse. But it is a challenge that's starting to see some progress being made. I'm taking a trip with Director of Public Health for NHS Health Scotland across the city of Glasgow to find out more about the problem here that's repeating itself across the country.
Health inequalities is a lost potential. Lost potential for people leading happy, healthy lives, lost potential for the country and for the communities.
We start our journey in the deprived area of Bridgeton in Glasgow's East End, ending up in affluent Jordan Hill, following Glasgow's life expectancy map.
There are dramatic differences, and we look initially at life expectancy. So a child born here, a boy born here, currently can expect to live into their mid-60s. So they get to what we think is retirement age, 63, 65, and half of their friends have died here. A boy born in Jordan Hill can expect to live to their late 70s. In Jordan Hill, they can expect to go another 13, 15 years.
I head to the city centre to meet Gerry McLaughlin, Chief Executive of NHS Health Scotland, one of the organisations trying to reduce health inequality across the country.
We want a fairer, healthier Scotland, and that's essentially what we are working towards. So a much fairer distribution of those life chances, those life outcomes. Even in a city as developed as Glasgow, quite clearly the way in which we distribute our resources across the city are really quite different.
Making sure every person has equal access to support that goes beyond their health problems is the key to solving this health crisis. And a thriving money advice service here in one of Scotland's hospitals, the Royal Hospital for Children in Glasgow, is improving lives. For young mum Kirsty Telfer, whose twins were born at 27 weeks and are still in the care of the ward, getting financial advice and care from the team here has been a lifesaver.
One of the nurses had suggested just coming over here to see if there was anything they could do to help. They were very friendly, they were very welcoming. They can give you grants, they can help set up with your child benefit, your tax credits. You know, you've got enough on your plate with the boys that, you know, you don't want to be worrying about money as well.
Frances McGuiness is a family support worker at the hospital.
It's a very unique service. Probably one of the biggest things we do is emotional support to parents and carers. It could be to do with money. They've got problems with money, and then in that case we then refer them on to the money advice service attached to this service. So it means that the families don't have to go outside the hospital. Anything they need they can get inside the hospital.
NHS Health Scotland supports projects like this because evidence shows that linking patients with an advice service works to change health inequality. So when patients and carers here were asked about their biggest worries whilst they or their family member was sick, it was finance and not health itself that was their biggest stress.
The Money and Debt Advice Project was set up, and that is a partnership between the NHS here in Glasgow and the advice sector. And what that means is that there is an advice worker who's based here in the hospital as part of this hospital service, and nurses are asking patients about their money worries when they come in and referring them to the money advice service.
Partnerships between the NHS, private and third sector are starting to bear fruit in Scotland, and the hope is that by tackling more than just a person's physical health, this decades-old health divide will be broken for good.